I know for the folks that have attended our past symposia and some of our other offerings, understanding and thinking about care from a trauma-informed lens, to me, this was another layer of that with understanding the racialized trauma and the generational trauma. I'm wondering if you could talk a little bit. And so when I was thinking about our next offering, this seemed like another building block on some of the things we've offered before. I'm wondering if you could talk a little bit more about if folks have had some of that trauma-informed training, maybe with us or with different organizations or folks, how does this connect and build off of some of that prior knowledge?
Well, I think, again, the sort of the neurobiological piece that we built in, and that's also can be explored in, other trauma-informed courses, but the fact that we do look at it through the lens of racialized trauma, that's the big problem. That's the elephant in the room, is that we keep not wanting to look that squarely in the eye. And that is, we're going to talk about that. The United States, we are a nation of immigrants. Even if you go back to the 15 million indigenous peoples that once inhabited this land prior to colonization, prior to the Middle Passage and the slave trade, they too migrated across landmass when the continents were all one. They came across those Bering Straits. So even they are immigrants. So we are a nation of immigrants, bar none. And then over time, the artificial construct of race was created to stratify people for economic advantage. And we're still operating out of that system. So it is a hard truth and a hard history that we need to examine, and none of us can escape it, and we certainly aren't going to change it doing the things that we have been doing in the past. So that's the additional piece. So yes, there are trauma-informed courses, and unless those trauma-informed courses are head-on addressing this racialized trauma, they're missing a big part of it, because that's the big problem in this country right now, and globally. Unfortunately, we're seeing this proliferate around the globe, but we're here in the United States, so I'm going to focus on what's going on here in the United States.
Yeah, and to add on to that, I mean, I've had the good fortune of attending Kim Barthel's course last year in person. It was just about the last in-person conference before our wonderful COVID hit. And like I said to Carol, we've got big shoes to fill. I mean, she does a wonderful job of addressing trauma on a lot of levels, including race to a certain extent. But this really, as Carol says, brings it to the forefront. Let's just call it what it is, and this is really part of what we need to address. Something else that keeps coming to my mind, if you don't mind, I'm going to share this too. One thing I've found since I've been doing really more intentional anti-racism work, and even to claim that work as anti-racism, I've really been really aware of ways in which I interact with people and how that might be different. So particularly in the clinic that I work at Children's in Minneapolis, which is, of course, very, very near the site of the George Floyd murder. And I really found, as I was working with kids virtually, after that, I just became really aware and was more likely to say to a family, for example, of color, I'm aware that, you don't live that far away. How's this going for your son? And he's like, he's so anxious, not sleeping. I mean, hearing that still over and over again. And it really, I don't know if I would have asked that question 2 years ago. I'm not sure if I would have, or if I would have been afraid to ask the question. Mm-hmm. And I just find that I'm much able to, I don't want to be in a respectful way, but really ask sort of, again, the obvious. He's happy to be at virtual school because he's not getting bullied, or whatever that might be. So I just really wanted to share how I have found doing this work and teaching this work and always learning more has impacted the way that I practice.
Yeah, and I think that's the invitation. So, many of the people who will be attending are obviously in healthcare professionals and in allied health and what have you. And, our avatars are other human beings. And to bring this awareness into the room with you, because you're not in the room with a white person or a black person or a red person. You're in the room with a multifaceted human being who has a lived experience. And I feel that in being a medical professional, which I love so much because I love intimacy, and we truly have the opportunity to be intimate with other human beings that is not available in other professions. I need to be curious about you. I need to understand the derivation of your last name and your grandmother's journey and what her lived experience was like, because how I treat you and the recommendations that I make to you should be based on the context of your lived experience. And so, yes, there is that one obvious layer, but you're much more than that. You're much more than that. So I might be treating hypertension, for example, in both of you. But when I learn the history and the story of Kathy's parents and grandparents, and when I learn the history and the story of Heather's parents and grandparents, I might make slightly different or even radically different recommendations based on understanding your medical and historical narrative. And, those are the kind of medical professionals that I want to see when I need to go see someone for my own treatment and for optimizing my own health and well-being. And these are the kinds of medical professionals that I want to be involved in training and cultivating and educating and saying you are fit to treat another human being.